My story is I was out riding one of my dad's racehorses and she got a fright or something and she reared up and slipped over and landed on top of me and it broke my pelvis, but I had a helmet on and a back protector, so I was all good here, but my pelvis wasn't so good. The hospital people said to me about blood clots is that because I wasn't allowed to walk basically for up to 8 weeks, that the blood wouldn't circulate properly and it could cause blood clots and that could damage, I couldn't walk. If I got blood clots I wouldn't be able to walk and could damage my lungs and my heart. I found it quite scary because I had never heard of them before, but it was good that they explained to me about a young girl that I knew that had gotten blood clots because they never used to give it to people my age, and she was my age when she got hurt on her horse, so that made me more comfortable about it. If I hadn't had the assessment for blood clots, I could have had serious damage to my heart, my lungs, or could permanently not be able to walk.
The aim of the intervention was to provide patients with an evidence-based and standardised approach to VTE prophylaxis, and we wanted to measure the outcome of our intervention with repeated PDSA cycles, looking at the appropriateness of VTE prescriptions and the risk assessment. And we're able to demonstrate over time that less VTE events were occurring, that we were effective with our thromboprophylaxis, and the uptake of VTE risk assessment was 70 to 80% for all departments.
It is important to assess every patient for their VTE risk because every patient is different, and the consequences of not giving VTE can be quite distressing for the patient and bad for the patient, requiring long courses of other medication. And in contrast, giving someone VTE when they don't need it can have side effects which can also be disastrous or bad for the patient. So it's important to think in each case, do they need it, do they not need it, why, are there any reasons why I definitely shouldn't be giving it, and are there any reasons why I definitely should be giving it, so you make a good informed decision.
So it's really important to assess women antenatally and postnatally. You know, antenatally they may have one risk factor, but then postnatally you reassess them and they may have gained 1 or 2 or 3 more risk factors. So the form that we use is great because it's got about 5 little boxes on the bottom, which encourages you to keep reassessing. So it's not just a one-off form, it's a form that stays in the notes and encourages you to reassess.
So what prompts me to run through the VTE assessment on each patient is 2 things. First of all, the drug charts themselves have an area where it says, have you assessed the VTE, essentially? And whenever I'm writing the other drugs up, that's always there to just see and remind me, have I done it, have I not done it? And you can tell, because if you've signed it, you've done it. If you haven't signed it, you haven't done it. The other way is that on my admission book clerking, there's a section at the bottom which says DVT prophylaxis, where I should write yes, no, reasoning behind that, and that reminds me to decide to at least think about it for each patient.
Our outcomes have been very encouraging. We've halved our VTE event rate, and we're able to prevent 3 deaths from hospital-acquired PE events. And through review of the mechanical thromboprophylaxis, measures like foot pumps and long TED stockings. We estimated in a year we have saved $40,000. And by reducing the VTE event rate, or halving the VTE event rate, we estimated the cost to be maybe up to $90,000 a year. The lessons we've learned from our program is that it is important to keep an eye on and focus on VTE thromboprophylaxis through auditing, through education. The minute we let it slip, you know, the busyness of clinical work takes over and it just slips everyone's mind. To have, you know, that visibility that somebody actually cares about it, monitors it, I think has been extremely valuable. And it allows us to feed back to clinicians how they're going and how their patients faring, you know, like no VTE events for a month, for 2 months, which is, you know, a really great improvement for us.